Okay, so my name is Dr. E. I'm the founder of Human. Human's all about how we can help pioneer a new era of healthcare to benefit everyone. We work with people across goals of longevity or living longer and stronger, increasing health span, or optimizing their state right now to take control of their body so they drive it and the body doesn't drive them. Superhuman Protocol, it's all about helping you change your state and give you the superpower of health. We believe that experiencing is believing. If we can give someone in a short period of time a different state of health, better energy, mood, focus, digestion, immunity, in a short period of time, and they experience that difference, they will experience their life with that superpower of health. And that's what the Superhuman Protocol is all about. It's 4 steps. Step number 1, it's a blend of IV nutrients with laser light into your veins. Then followed by hyperbaric oxygen therapy, which is the most relevant to slowing aging down. Followed by whole body cryotherapy, taking you into an environment where you go down to minus 140 Celsius for up to 3 minutes. And we believe that that in itself will also have some longevity benefits if done regularly. So the combination of these 3 in relation to longevity are going to be regarding 1, stem cell production from your bone marrow with hyperbaric oxygen, 2, mitochondrial function, improving mitochondrial function with the nutrients that you give intravenously, with the laser light activation into your blood, and also the oxygen delivery at high concentrations with the hyperbaric oxygen. The other consideration to be done is with the whole body cryo, and the cryotherapy has really great effect from increasing metabolic flexibility. Now, one of the big drivers of aging is metabolic inflexibility. It's insulin resistance that happens over time. It's cardiometabolic problems causing vascular disease. So if we can increase and improve metabolic flexibility, which is ultimately our utilization of energy and how we find energy quickly, and you'll need to have good insulin sensitivity for that. If we can practice that or create environments where our body practices that, we will be improving our metabolic state and therefore decreasing the deterioration that comes along with it. So this is why we believe the Superhuman Protocol, although it's more about the here and now, it definitely has a role for longevity. And that's something that we're going to be working with GlycanAge to trial and test and to really work more out, because ultimately we want to be spreading this far and as wide as possible. When I started looking at how we could deliver pre-disease healthcare to make people better in the shorter term, the starting point was to look at the definition of health. How did I want to define health, and how do I want to define what I want to achieve with our patients, right? And so we redefined health as a state of absolute vitality. And from a longevity perspective, we produce health as an output, and that starts to decrease. That total output of health that we produce starts to slowly decrease from our late 20s, early 30s, and we're on a gradual decline towards a disease state where traditional medicine has given us the symptoms to ask so that we can diagnose these and investigate these disease states, and then the associated investigation and management pathway. So what I wanted to do is help identify that whole process that happens before that decline. What happens? How do you identify that? So we started with that definition of health as an absolute state of vitality, and that's what we're trying to engineer. And then thereafter creates new symptomatology, symptoms to look for any movement away from that state of vitality, right? And we broke vitality down through surveys with our patients into 14 states: energy, mood, sleep, focus, digestion, immunity, inflammation, libido, fertility, sleep. I might have said that already, but 14 states. And then from there we ask standardized questions around those states to understand where someone's slightly deviating away or more than slightly. Then we further investigate with advancements in testing that include GlycanAge and other tests from science to identify where someone's at and imbalances that may be causing those fringe symptoms. So new symptoms, new diagnosis of health, new investigation, and new management pathways. Management pathways that include hyperbaric oxygen, whole body cryotherapy, intravenous systemic ozone therapy, systemic laser applications, peptides, all. And the theme around our approach to therapeutics is about self-regeneration. Everything that we do here is extremely safe when delivered in the right ways. It's a non-drug, non-pharmacological based approach. Even supplementation is extremely safe. I think inflammation is the new currency of medicine, and we all need to try and understand inflammation more. If we think back to the 90s, it was all about cardiac health and vascular health. It was heart attacks, it was strokes, right? And we began to strongly understand the determinants of that. And we started to improve management and early identification of the processes that drive heart attacks, strokes. Then we went to the 2000s, and it was all about metabolic health. It was all about insulin sensitivity and insulin resistance and blood sugar regulation, and the sequelae of that. And now we've moved into an era where it's about inflammation, and that's definitely been brought on by COVID. We know that very simply by two people can get COVID and have very different responses, all mediated by how their inflammatory pathways are activated. Their resting baseline levels of inflammation, and also an understanding of how inflammation can affect all your systems and organs. But inflammation is basically an activated part of our immune system. A healthy immune system has inflammation pathways in check. An unhealthy immune system creates the environment for inflammatory responses, which can affect all of your systems and organs, including, now we know, your blood vessels. Your blood vessels become more leaky, more porous, and things start to leak out. And that's what ARDS is with COVID, and when it was really acute. That's exactly what was being caused, leakiness of the blood vessels. Now, from a functional medicine perspective or an integrated medicine perspective, we're looking at the root causes that drive inflammation. Okay, so what is it that causes your immune system to become unbalanced and unhealthy? What are the factors in your environment? How you sleep, how you eat, how you move, how you control stress and respond to stress. Then it's your biological predeterminants. How healthy is your gut lining? It's actually an externally facing membrane, but that's internal, right? And it's there to process our foods that come in to, but that external membrane can actually start to become more porous and let things in. How toxic is our environment, and how are we able to process those toxins through detoxification pathways? Do we have the right nutrients to do that? Do we have any genetic SNPs that would predispose us to need extra support for detoxification? So as you start to unravel inflammation and look for the root causes, you start to realize it's such an interconnected approach that's required, that looks at how you can coach people on their environment, but also looking at the right markers to ensure that you're looking for sources and you look for manifestations of inflammation. Inflammation is a constant check-in process that we need to do, right? And if we allow our body to deplete, then we allow inflammation to accumulate. If we allow our body to restore, we allow our body to heal against inflammation. Okay, so restoration is absolutely critical in any strategy for calming down inflammation.
Can you tell me a little bit about how GlycanAge fits into your process here and what value it offers to your clients?
It's been really fascinating. When I first met Nicoline and the team at GlycanAge, I thought it was more of an academic marker, and where it was just something that you would look at just academically. And then having talked to many of my clients about it and seen their interest in what GlycanAge can show, the value it can bring, I realized the value is actually in patient motivation, in client motivation, in self-understanding. It's a bit like when you wear an Oura ring, right? It's not the ring, it's the data, and it's the value of that data to the person that's looking at it. It opens their eyes. It helps them understand. We forget as scientists, this is our world, but everyone else outside of it is new to them, and so GlycanAge is something that very quickly helps people understand the internal processes that drive aging, and aging as a process, because we're in a period of time where we need to create and encourage a paradigm shift on the way we look at health, away from a state where it's something that is predetermined, sickness is predetermined, to a paradigm where we look at aging not just as a process, but something that we can control. And that is very much needed, going back to the definition of health, because through that process of we can empower people, we can empower communities, we can empower education systems, we can empower individuals and also ourselves to feel like we have more control, to feel like we have more autonomy. And with the data points, we influence and track those data points, which then reflect on how ultimately we age. And aging is more than just a number. It's about how we're going to have the ability to live our lives. And we're so disconnected to the future usually, you know, but I think with GlycanAge we can connect to the future very quickly and connect to the past as well.
So you're saying it's a very neat tracking process where your clients can check their progress as they go along?
I think it's a way more than just a tracking process. I think it's an eye-opener. It's a window into themselves that helps them understand. I've done it many times with patients, and you can see their eyes open up. You can see the information then becoming easier to digest for them, and the role and significance of things they do. And especially when they see things improve, it's great. Or not improve, they learn. You know?
So when it comes to your programs, who is it that participates usually? Is it limited to a certain group of people? Who are your classical clients?
Yeah, I mean, it's a tough one. You know, when I set up HUM2N, the brand, it was, do we want to just work with people that have diseases and problems? Of course we want to work with people that have problems. We want to get to the root cause and resolve those issues and help them with that. But this type of healthcare can also be applied to anyone at any point in their lives. We don't work with children, usually. Sometimes we work with some, but usually we work with adults or young adults onwards. And then we work across whether you have a problem or whether you have a goal. And maybe your goal is to resolve that problem. And if the problems are related to symptoms and how you feel, where we can do things. But if your goal's on improving performance from your body, we can work with that. If your goal is to live longer, we can work with that. Yeah, so health should be for everyone, and we're trying to make it way more accessible through education online, through sign up to our newsletters, to building a community, to doing things with like-minded people like GlycanAge, because ultimately we have to help people understand their blind spot, the unknown to them, which is this very thing that aging is a process that they can influence. Their state of health is something that they can influence, and they can take control of their destiny.
The last thing I'm going to ask you is a little bit about your team. So what can people who come to HUM2N, what can they expect? What kind of support can they expect?
So I'm going to just go through our four main brand values and important things that we all live by here. One is being compassionate. So you can expect people to listen, to spend time to understand you. We start with a 60 to 90 minute consultation where we go through all of your systems of health, not just looking at, you may come in with a digestive tract problem, but we're going to be asking you about your mood, your sleep, your immunity, your fertility. We're going to ask you about everything, because we're going to ask about your generational history. We need to understand where you come from, where you are, and what's around you, your environment. Right? So compassion, empowerment, right? Through meeting you at your level with knowledge, but not overloading you with a prescriptive approach. We're going to handhold you through a journey. That's our intention, and that's how we set up. Data-driven, we are data-driven here, and we want data to influence our decision-making, but we use data sparingly. We don't overload people with testing. We've created our own systematic approach through testing, stage by stage. And through that, we're delivering an integrated care team approach. We have a team of physicians. Within our physicians, we have psychiatry, sports medicine, general practice, radiology. Within our nutritionists, we have different specialisms. We have functional nutrition. We have health coaching-based nutrition. We have food-based, healthy chef-based approach as well. And then we have breath coaches, performance coaches in our team. We have a physio, strength and conditioning coach, more on the sports side and performance side, where we do, on that side we're working with athletes and applying this type of healthcare to athletes as well.